Dumelang, and welcome to Mommy Diaries. This show is all about motherhood, parenting, and this amazing journey ya go godisa bana ba rona. On today's show, I have the beautiful Malebogo Gaborone. She's a clinical psychologist. How are you?
I'm good, thank you. How are you?
I'm good. We just literally spoke about how young you look to be I know it's wrong to say this, but you look so young to be a clinical psychologist.
Let me say that keeping people's information confidential keeps you young. Follow up Poppy Act and then you'll look
You lying.
radiant. I'm telling
So I
you.
must stop.
Asombli.
Yeah, have you always wanted to be a psychologist?
I always say that becoming a psychologist chose me because I had chosen other things and then psychology became my second major and that's how the love began. And here I am now.
Yeah.
So everything about it, the experience, the educational process has been you are meant, your passion, your purpose is becoming a psychologist.
Yeah. And what did you want to study before it found you?
Before it had something to do with economics, but my last option was like social work. I didn't even know. I had an idea, but I knew nothing about psychology.
Yeah. And look at you now. Clinical psychologist.
Thank you.
Is it a difficult work? Like, I get it difficult. Obviously, every work has its own challenges.
Yeah.
But I can imagine having to sit down and hear people tell you their problems.
Definitely. It's quite a difficult work. There's a lot we go through ourselves, but most importantly, we hear really difficult circumstances and we try our best to kind of guide and support patients. But it does take a lot. That's why we also get certain help in order just to help us navigate the whole process. But other than that, it's such a beautiful work that I enjoy doing. Yeah.
It's amazing how times have changed where now we understand what information is and knowledge.
Yeah.
I've never heard my mom, she has depression. She's got 5 kids. After this child, I went through a depression.
Yeah.
Depression is, we now know what depression is because of the amount of knowledge and information we're getting. So now we're talking about postpartum depression. Now there's another one and another one and anxiety on top of that. So what is prenatal depression and postpartum depression?
Okay. So when we speak about perinatal, some say prenatal depression.
Is there a difference?
Some say perinatal.
Okay, there's a perinatal depression.
No, I think some people just, the pronunciation, not that the spelling out is different.
Okay.
I think some people say prenatal, some say perinatal depression.
So what's that right?
It's spelled perinatal.
Perinatal. Okay. My English is not the one. Perinatal depression as is perinatal depression. The difference between perinatal depression and postpartum depression.
Yes. So the difference is with perinatal depression is the depressive symptoms happen during pregnancy.
Okay.
And then postpartum depression happens after you've given birth. So that's the only difference.
Yeah.
But in terms of the symptoms, the severity, there is similarities coming to that.
Okay. So the one that happens during pregnancy.
Yes.
What are the symptoms? How do you know that this is now not you how you are going through something? How would one know that they are going through this particular depression?
Okay. So mommies would usually, or let me say, when we speak about depression, we're speaking about experiencing depressive symptoms for most 2 weeks or more, where you have 5 or more symptoms. Now, when we speak about these symptoms, we would be speaking about low mood or having less interesting and pleasurable things that you like to do. So now all of a sudden you don't want to do all those things anymore. But other symptoms that we would look at would be like we're feeling low appetite or high appetite, eating a lot. Some people, mummies, would complain about sleeping. But even if after they sleep, they don't feel rested or you do not have the ability to sleep. Concentration difficulties, feelings of guilt and hopelessness or helplessness. Like nothing is ever getting better. It's just getting worse. But most importantly, speaking of perinatal depression, we also emphasize on the bonding with the baby. It's a bit of a struggle in how you bond with your baby and get to understand your baby better. Yeah.
And what are some of the misconceptions that we have about, because I'm sure going through perinatal depression, uluko high. I'm sure about podcast. No, come on, relax. Maybe you're just it's just hormones. What if? How can one separate between that maybe it's just me going through my own my hormones are imbalanced and they're all over the place.
Yeah.
And this is, even though after you mentioned the symptoms, and then now you know, and my question is, how do you know then this is the depression, not the hormones?
Okay. So that is a beautiful question, because initially hey, what if? You know, people also people assume it as like sadness that will go away after some time, right?
Yeah.
Other terms that are used, other people use baby blues. I'm experiencing some baby blues, right? But when we speak about this kind of sadness, it goes long. It continues for a long period of time in terms of weeks and months. The baby blues, it could take 10 days or 14 days and then mommy gets better. Okay. Because let's be honest, it's quite difficult to adjust to a newborn. It doesn't matter how many times you've been a parent. Experiences are different. And at the time, the pregnancy finds you in different social-economic points, right? 100%. So it doesn't mean if or anything of that sort. So it also it gets better, right? But with clinical depression or perinatal depression, sometimes it does not get better. It just keeps on going and you're not getting better. But most importantly, I'd like to say some other people get a bit irritable and frustrated. So it's not always that the person would experience sadness, but you know, that they're quite frustrated and quite irritable, right? In a sense.
And it's really more perinatal depression. A lot of people would say if it's planned pregnancy, because sometimes we associate it with stress. I didn't plan for this baby, and now I have to go through this. Obviously, one would be sad. One would maybe eat and not eat because of the stress. I did not plan this. Now let's talk about women who planned their pregnancy. They've always wanted to be pregnant. Now it's happening. Do they also go through perinatal?
They do.
Really?
They do. Honestly, it's such another beautiful question, because now I also want to say you could exercise, you can do all these things, but sometimes depression is also chemically. That's why people need medication. So that's why you find even when people are exercising, I'm eating right, but nothing is coming all right. So that's where medication and chemically things come about, right? So that's why even when your pregnancy is planned, you've bought all these things and it's beautiful. Daddy's there, family's excited, but something is not right for you. And that's why I would say it's important for you to consult with your doctor and just find out what is happening for you. What are the difficulties?
Therapy during pregnancy?
Yes.
Is it important?
It is important, right? If your doctor does refer you and if you feel like you need that psychological support in order to manage your upcoming expectations, in order to understand also your coping mechanisms and how to maneuver around all this therapy, there are patients who come for therapy during their pregnancy, and some also who have history of mental illnesses. They come for therapy in order to get the necessary support, whether it's a short-term or long-term process. Even after giving birth, they still continue. It's still fine. It just depends case to case.
Yeah. And does it build up? When I say build up, you know, a lot of moms, for example, would more survival mode, and they don't have time to actually reflect and be like, actually, I do have this, or even have the means to go to the doctor to check if banally by diagnosed for perinatal depression. Does it build up to the point where by the time you give birth, it's a depression or it's a post?
Yes, definitely. Actually, most of the time we find that they've already given birth.
Yes.
And now they're struggling. But then when we had that clinical interview with them, we realized, no, these symptoms have been there all the time, or even been there before the pregnancy itself. It's just that mommy was able to maneuver around it, right? And then after giving birth, that's where the trigger was for her. So triggers are in different stages for different moms. Yeah.
And let's talk about post now.
Yes.
The symptoms.
Yeah.
What are the symptoms that post?
So the symptoms are the same as a perinatal depression, and in terms of clinical depression, where we speak about the low mood, disinterest in activities, the appetite difficulties or fluctuation of appetite, fluctuating of sleeping patterns, experiencing of guilt, hopelessness or helplessness. I guess we'll also get to it, but the risk also could be suicidal ideations, like suicidal thoughts, or even thoughts about wanting to hurt the baby. So the difference with, like we said, the perinatal and postnatal, the other one is just during. The postpartum is after you've given birth. Yeah.
And then, like, when you say hurt the child, is that feeling of sadness that makes you hate the child? Because I've heard people saying that they've looked at their kids and they hated them.
I'm going to say it depends on different experiences of parents. Some parents would say, if I die, my baby comes with me. You know, and then there are some parents who feel like, I do not want to do this. Like you said, unplanned pregnancies. When Nalepasi, we are in a relationship, we decide to have a child. Sorry about that. And then Pasi decides to pull back, and it becomes such a burden to me. You know, there's a lot of processes that happen in that. So I don't want it to be on just one decision. It's a hateful for baby. For some parents, it's like, I'm protecting my child. If I'm going to kill myself, my child is coming with me.
And what's the difference between, like you're saying, just having matata apopilo and postpartum depression? Because, like you're saying, some people give birth, the father of the baby decides to be absent, or he disappears on her. So that's not depression, right? It's just you're going through something. Or is it depression?
That can cause depression on its own, because it has emotional and psychological impact on mommy, right? It could be one of the triggers, right? On top of the fact that maybe you had a long-standing mental health history, or even that on its own can have an impact on triggering or you having the symptoms. So I wouldn't necessarily say that that's the only thing that would cause. But it does have a huge impact in triggering depressive episodes.
And then support, like when you're pregnant, you realize that you can't do it on your own. You need, whether you have the depression or not, you do need support. What advice would you give for people who are around women who are going through that, whether it's prenatal depression or postpartum depression?
I think the nicest thing about pregnancy now is the fact that it's such an exciting thing and people prepare for it, right?
It is?
We're ready baby shower. Baby shower.
It looks easier than it was before.
Exactly. Honey, we discuss the ideas and the intentions and expectations of everything, right? I think it's also important for us to communicate, if there are certain things that happen to me, how would you like us to communicate in order to understand our difficulties? But another thing in terms of our loved ones, if we have to speak about it culturally, but also when Asian people do it, called the prenatal confinement, where your mom or your grandmother is the one who's taking care of you after you give birth. And then you have to sit for 6 weeks, others by 3 months. It's strict depending on culture to culture. So that kind of experience has also, I've seen for some people, it might be perceived as isolation because for other people, it's such a supportive experience in a sense that people get taken care of by the mom or grandma or nanny, and the person has eaten, but also that person who's doing the care is aware of certain changes between mommy and baby, right? And if mommy is struggling in order for the baby to latch or the bonding, then that person is also there to guide. So I think that has also been quite supportive. But another thing is, I think also as a mommy, learning to just communicate your feelings and your challenges. I know there's fear around that. I know there's stigma around that. There's also internalized stigma of feeling as if I say something, then it might be perceived as if I'm weak, or I do
or a
not
failure,
know, or what if when I tell them I can't do something. So I think it's important for you to share your concerns so that your doctor or your family members can know how to support you. Yeah.
And that support for me, for example, when my mom left, I felt like I got depressed because it was so nice when she was there for those months. But when she left, I was left with this little girl and my mom was gone and she left because she had to go.
Exactly.
And that for me, I think it caused a little bit of depression because I didn't know what to do because most of the time, she was the one who was helping me all the time. Highly funerally on the day, it's like your reality is hitting you. And I think most women go through that, and then they also can tend to fall into depression because of now the support all of a sudden is gone. Now you have to look for a nanny. Now it's you and your husband.
Figuring out how to also bond with the baby. So when mommy was there, it was simple to say, oh, so now you have to navigate it yourself. And sometimes I do reassure parents to be like, it's okay that you're trying to navigate it. It's not meant to be perfect. You're figuring things out. And if you can't figure it out, I guess mommy is a call away to be like, exactly. I don't know what to do anymore. So I think it's a normal thing to find it difficult to adjust. But after sometimes it does make sense.
So now we spoke about the symptoms and the signs, and for both because they're very quite similar. But now for someone who doesn't know what's happening to them, and no one can see what's happening to them, but they're feeling this sense of
yes.
Is there medication for people who are pregnant for the depression?
Yes.
Or not?
There is medication that caters to the fact that mommy is pregnant and possibly mommy would want to breastfeed. So you just go to your doctor and you guys discuss the regimen around that, because you need to remember that other people who are pregnant also have medical conditions. And some medical conditions you need to be on medication for a long period of time. So that's why it's important to speak to your GP or your gynae or the specialist in order to navigate around that process. So there is medication that is quite helpful for the pregnancy.
And then besides the medication, besides the therapy, you know that there's always like different tips that one can try maybe at home. Some people will like exercise, take a walk. What advice would you give like for someone who's maybe like, I know I'm going through this, that they can try at home just to help them, make them feel a bit better?
I think it's also important to like you said, going out and exercising is quite important. Finding things that you actually do. We've heard moms feeling as if like you completely lose yourself. You completely lose the kind of person that you were before the pregnancy. So finding things that you like to do. And also another thing, parents would be like, but how am I going to do it? Because as soon as the baby I have to sleep because it gets tiring. But you navigate around it, having a space for your time, whether it's a bath, whether it's a book, whether it's a movie, just take it one bit at a time. That is quite helpful. But I also wanted to say, besides the therapy and all of that, there are some prenatal groups that help with moms who go through the same thing, where you guys can share your difficulties and your concerns.
And the symptoms that you spoke about, do they affect people differently because we're different people? Or when I say affect them differently, is it just all of those symptoms, or some are different because of different individuals?
The symptoms are different. Remember how sometimes depression is perceived to be someone who's sad, someone who's not doing anything. There are other people who may present with anger, irritability. Some people would eat a lot instead of eating less. Some people would sleep more instead of not sleeping, a different presentation. So definitely it presents differently for different people.
Okay. And then lastly, and then besides the, like I said, you spoke about exercises and all of that. Now, how does it affect the relationship? Let's say you are married or you have a partner that you're still with and you're going through that. I'm sure that can affect your relationship with that person. I'm sure if it wasn't for you, of whatever reason, how does that affect the relationship between parents, not just the bond between whoever is going through the mom and the daughter or the child?
I think we should be honest in a point that both parents are trying to figure out how to become parents, right? So that on its own becomes quite difficult. But if you have one parent who's having postpartum or prenatal depression, it weighs a lot on the other parent.
Who's not going through it.
Who's not going through or going through it. Sometimes you find that if mommy is having depressive symptoms, then the whole experience becomes quite difficult for dad as well. And he can also develop a depressive episode or depressive symptoms. So depression is not only to mommies. Even dads can also have experience depressive symptoms during your pregnancy because it is a huge transition, right? A lot is happening. So in terms of them, it could lead to the fact that one needs to do more of the responsibilities compared to the other, right? If I had to give like an example, the point that possibly mom would never be going back to work and dad now has to take the financial toll of every single thing. If there was some sort of a structure in the house where mom did a lot of duties around the house, and now because of symptoms, like we spoke about, the fact that you are unable to do certain things, now dad has to take over and he doesn't even know how to do it. And mostly there are other small kids who the structure changes a lot that can lead to a lot of tension within the relationship.
And do you think our parents went through this?
I think they did. I think they did. They were human. It's just that context, social, economic issues, culture was different at the time. But I think our parents and grandparents went through this.
It's just that they didn't know what to call it.
Sometimes I listen to my grandmother or my mom speak about their difficulties and I'd be like,
nearly depression. It's just that they don't understand.
They don't understand, yes. And it's hard to understand because there's a lot of generational processes in between. You know, so
And anxiety, does it contribute to one having prenatal depression and post?
Yes, good question. Anxiety and psychosis. So we have another type that we did not address, which is postpartum psychosis. So this is when mom starts after birth, I guess mom would be starting to see things that are not there and hearing things that are not there or believing certain things that are not there. And they start acting indifferent in a sense that it might be risky for the mom and the baby as well. In terms of anxiety, you experience excessive worry, like you can't control the worry no matter how much people reassure you and validate you. You don't, to a point that sometimes it can lead to a lot of fatigue. And if we had to speak about physical symptoms, you would have diarrhea, you tension up, you have constant somatic symptoms, which is painful body or headaches. So definitely there are anxiety and postpartum psychosis.
So the psychosis, it's a like the psychosis.
So it has been linked to depression as well, the psychosis, where maybe mommy has been, the severity of the symptoms can lead to psychosis, right? For others, I would go back to also the fact that if mommy had a long-standing mental illness as well, and maybe decided, stop our medication because I think I can manage, that can have triggers. So there's really multiple triggers that can cause postpartum psychosis during pregnancy and after giving birth.
So during pregnancy, after giving birth, we spoke about prenatal depression, postpartum. Now there's
postpartum
psychosis. What did we leave out in terms of like depression?
I don't think we left out anything. I think the one that we can speak about also is the fact that, or we can emphasize a lot, because we spoke about chemical imbalance. We can also speak about the causes of the postpartum depression or perinatal depression can also be due to hormones, because we should remember that during pregnancy or even our menstruation cycle, there's fluctuation of hormones on its own. So that can have quite a heavy trigger or consequences on us developing postpartum depression.
And
Mm-hmm.
and the prenatal depression.
Yes.
And how do we handle that? Because the hormones are, even when, like you're saying, when you're on your period, like, get a wash out, you know? And the older you get, it gets worse.
Exactly.
It doesn't get better.
Yeah. So this is where it's important when you go to your gynae or you go for your checkups in order to have a discussion with your doctor in order for us to establish exactly what these symptoms are. When do they start? How long have they been there? How do you feel when these symptoms happen? And how does it affect your relationship with your baby?
Yeah. And once you see the symptoms, you go to the doctor. How do they diagnose that, okay, this is prenatal depression or postpartum depression?
So usually gynaes would either refer you to a psychiatrist or also psychoeducate you first to say, psychoeducate meaning teaching you. Okay, this is what we think is happening, and I think it would be best just to consult your psychiatrist to kind of establish what is happening. If there is other psychological issues and they feel like these are things that can be managed if the patient or mommy has someone to talk to, then we would the gynae or the doctor would refer the patient to a psychologist or a social worker in order for us to kind of help navigate or manage the symptoms. Yeah.
And then what advice would you give to a mom right now who's watching, who's like, oh my God, now this is it. This is what I've been going through. What should they do now immediately?
Okay. I think it's important for mommies to firstly speak up. I know it's not easy. I know there's so much fear and like we spoke about cultural stigma. This is how a parent should be. This is how a mom should be. How mama
how mama.
how so,
yes, that's true.
So I think it's important to just share your difficulties with your doctor. Share your difficulties with your mom so that you can get the necessary help. I think let's rephrase it and say the more you speak about your difficulties is the more that you're aware that you can become a better mom and be there for your baby. So don't feel or don't fear sharing your difficulties with anyone. These things happen, and I think that's the reason why I agreed to come here to teach people that it happens and it's okay, and it doesn't make you any weak or less of a mother that you would like to be.
And in your own opinion, do you think social media can contribute to one all of a sudden feeling depressed? And when I say social media, I mean, like you said, like moms are posting, oh, my man just bought me a car, my man bought me this, and someone is sitting out there and it's the total opposite.
The push gift.
Yes.
You know, it does have an impact, right? Because some people would be like, oh, she looked beautiful on her pregnancy, and then now you're starting to compare yourself, you're starting to compare your relationship. So to a certain degree, social media is good because then we are learning so much, right? But at the same time, it's important to take just a little bit, not too much. Because now when you start comparing yourself, it can lead to a lot of things and impact the reality of your circumstances. So definitely, it has an impact.
And lastly, as a clinical psychologist, what is your role when in this whole pandemic prenatal depression and postpartum depression?
Okay. So with us, okay, so with psychology or clinical psychologist, counseling psychologist, we try to help clients or patients in order to navigate, right? And manage their emotions, coming up with coping mechanisms, right? Whether it's a short-term or long-term therapy process, sometimes we find pregnancy triggers a lot of childhood experiences. People have been through abuse or are going through abuse during that pregnancy. So that's where we come in terms of helping people process their difficulties, come up with coping mechanisms. But also, we also refer to other people. Like, for example, we'll refer to social workers in order to home visits or to establish who can help mommy. Because sometimes you find that the struggle is hakuna support.
Right. Yeah.
So social worker would come in and we'll try and establish gore ke mang ka support-ang mommy, right? Or we found gore mommy who complain ka partner and partner is struggling because he's going through his hormones.
Yeah.
So he can also come for therapy. That boosts support. So we try to be where we can in terms of different cases, but definitely to process, help manage emotions, thoughts and feelings around that.
Yeah.
And also, like I said, there's a lot of triggers that happens during pregnancy that we try to help patients with.
Yeah. And then for moms who cannot afford, like, but I cannot afford to pay a therapist or a clinical psychologist every week or every month. Are there any help available? Go to public?
Yes. So with mommies, babasna medical aid or babasna chelete, you can just go to your nearest clinic. A nurse or a doctor checks up on you. You share your difficulties. They can refer you to social workers or psychologists within your province or area. So there is psychological services in public hospitals and social workers who can intervene. Even if you go to your nearest clinic, because sometimes hospitals are quite far.
Yeah.
If they don't have psychological services, they refer you to your nearest clinic.
Yeah. Malebo, thank you so much.
Thank you for
coming. And I wish I was a psychologist. Yeah, to pregnant. Our psychologist. Yeah, baba saying preg.
You know what?
I get listen that. They get like a lemon. Single ladies. Get that like it will work at my singleness.
No, definitely. Psychological service I provide in terms of different processes.
Yes.
So it's not just prenatal.
Yeah. Thank you so much, my
Thank you for having me.
Thank you so much for watching. And don't forget that we are also available on Spotify and Apple. Let's subscribe and share. Thank you.